Pharmacy Podcast Nation. Thank you for coming back to the Pharmacy Podcast Network for Care Collaboration, discussions between pharmacists and physicians, collaborative agreements, practice, strategies, focused on the patient together. We're excited about this new series. We kicked off the first Care Collaboration with Dr. Mulani. If you didn't get a chance to hear that episode, that's Pharmacy Podcast, episode 972. Today's Care Collaboration is with a very special guest, Dr. Jennifer Caudle. Dr. Jen is a family physician dedicated to keeping families healthy, and as a practicing physician who treats patients for all ages, she's not only trusted inside the exam room, but outside the exam room, especially through major media outlets. Dr. Jen is one of the most visible physicians in America today, as she appears in homes of millions every week on television, in print, discussing health topics, recently discussing COVID-19. Today's Care Collaboration is with Dr. Cavallina and Dr. Jen, coming up here on the Pharmacy Podcast Network. Pharmacy owners, you work hard to do the right things for your patients and your community. That's why I'm excited to tell you about a product that makes doing the right thing for the health of your patients and also the right choice for your pharmacy's profitability. I'm talking about Pen Needle UltiGuard Safe Pack, which is an FDA-cleared product that provides 100 premium pen needles and a sharps container all in one. At the same time, when pharmacies dispense the Pen Needle UltiGuard Safe Pack, they see consistently higher revenues and higher margins. You know you're going to love choosing the Pen Needle UltiGuard Safe Pack. Visit ultiguardsafepack.com/podcast. Once again, that's ultiguardsafepack.com/podcast to see it in action. Pharmacy Podcast Nation, welcome back to the Pharmacy Podcast. Excited to have an extremely special guest who's all over the news and media, really a voice of reason at this point with what we're all going through as a nation, actually as a world. Dr. Jen Caudle, welcome to the Pharmacy Podcast. How are you?
Thank you. I'm great, and I'm so excited to be here. So I'm super excited.
You have the ears of 70,000 plus pharmacists right now, and we're excited about this because this is part of a collaborative podcast series that Dr. J-Max, Dr. Jason Cavallina, and myself has been doing for some time. I think we kicked this off about 6 weeks ago, and it's exciting because we want pharmacists and physicians doing more collaborative podcasting through the Pharmacy Podcast. And Jason, welcome back.
Everybody, thanks for having me. Todd, great to be with you guys. Dr. Jen, great to be with you. Excited to have this great conversation about collaboration and how pharmacists and physicians can be working together and advance patient care in this COVID-19 world we're in.
Nice. Me too.
And before we get started, if the listeners want to follow along, obviously if you're driving, don't be following along. It'll be in the show notes, but Dr. Jen can be found at Dr. Jen Caudle, CAUDLE.com. Dr. Jen, you are, like I said, you are everywhere. You must be so excited about being able to reach the public with evidence-based information and being able to be part of the checks and balances when we're all pretty on edge. We're pretty tense right now as a nation. Give us a little background of yourself.
Yeah, no, I mean, you know what? Honestly, I am really excited about this. And, I feel honored. I think of it as a privilege. I'm a family physician. I've been in practice for about 12 years, and I'm an associate professor at Rowan University School of Osteopathic Medicine. So I'm a DO, and, and in my academic role, I teach residents. I also am the clerkship director for the third year family medicine clerkship. So I have students. And I also see patients. And I do that work, I'd say, 2 to 3 days a week. And then the rest of the time, I'm able to do media work. And I really think of the media work that I do as like an extension of what I do in the office with my patients. You know, whether we're a pharmacist or a physician or other healthcare provider, we're always educating, right? We're always explaining, educating, answering questions, things like that. I really think about the media work, as I said, that I'm doing as an extension of that. Instead of talking to one patient or a couple or a family, I'm literally talking to thousands, sometimes millions, depending on the network. And like I said before, it's a privilege. I think it's an honor, and for me, it's a dream come true, because I really believe in the importance of education and health education.
Jason, when I thought about having the privilege of interviewing Dr. Jen, the very first thing I thought of is when you and I first talking about this collaborative between physician and pharmacist. Jen's popularity has been growing. What an amazing opportunity at this time when we're going through this COVID-19 stuff to have a platform, multiple platforms, but then this podcast too, going out to our pharmacist listeners. So I'm going to let you set the stage and kind of ask questions of Dr. Jen, and let's get in and dig into the elephant in the room.
Jen, thank you for being with us, Dr. Jen. It's great to have you here, and I really do appreciate the time that you're taking with us. And what feelings do you have in the previous, before COVID-19 world? In the COVID-19 world, there are now serious limitations on how many people are available to help. And pharmacists are saying, put us in, coach, put us in. We're here. Let us help. How can the players on the bench get into the game?
Well, I think the first thing is saying what you're saying, which is that, hey, we're here and we're ready and we're willing. I think that's it's such a gift, and it's a wonderful thing, and I agree. As healthcare providers, we're really all in this together. Physicians, pharmacists, I don't know if you guys heard about a medical school in New York. I believe either they have or they're considering graduating their fourth year medical students early so that they can help on the front lines. Medical students are sort of being potentially thrown into the ring, and we need our nurses and PAs, et cetera. I think the first thing is the willingness and recognizing the need for us all to participate. And, the hope is that we don't need everyone, right? That would be the hope. The hope would be that we can curtail what's going on with coronavirus so that we sort of flatten this curve as we've been talking about, and we stay under the radar to the point where we don't need to recruit everyone and their mother. But the idea is, I love the fact that as pharmacists, you're willing to help. As a family doctor, I'm not necessarily considered on the front lines, right? I'm seeing patients tonight via telemedicine from my couch. That's what we're doing now. Many offices are not open appropriately. So I'm seeing patients, but, I don't work in the ER setting. And I feel the same as you, that, if I'm needed, I'll run into an ER. You're going to have to give me a little refresher,
Exactly.
I'll gladly run into an ER. So, time will tell how and when we need to help, but I think it's good to be willing.
I'll just give you a little example of what I see out there right now. I have a hospital near us on Long Island whose ICU is only a 15-bed ICU. They have a PACU. That's the after surgery section, and they've converted the PACU into a non-infected coronavirus negative ICU. And they've moved their patients out of the ICU and just used those 15 beds in the ICU for corona positive patients. So in that environment, you had a facility that was running 5 days a week, let's say from 6 o'clock in the morning to 11 o'clock at night, or until the last patient wound up in a bed if they needed one. And that had a limited amount of need staffing.
Sure.
And now it's being asked to run 24/7. So there's a burden on the system, and we can see that burden, and we see that the government is building all of these great facilities. They have a tent facility, field hospital that they're building in Central Park. They're doing it in a couple other places in Manhattan. Build all the facilities you want, Javits Center, things like that, but you have to have the bodies to staff it.
That's right. That's
And
right.
so call us all in, right? I mean,
Right.
they're
Right.
already called up retired military medical individuals. So there are lots of us in the community who are willing to help. There's a lot of
That's exactly
pharmacists
right.
who are really, I would consider, to be on the front lines, because we're getting corona patients in. We're getting patients who are calling us because they're stuck at home. I have another patient whose mother and father died of coronavirus, and
Oh my
now
God.
her daughter is positive and being kept at home. So we're exposed, we're ready, we're
Right.
willing to help. And
Right.
outside of saying, hey, why are you still walking around out here? You should go home. We
Right.
want to be able to help. And us at RxVIP, we have developed really good clinical relationships with physicians. We collaborate with physicians on a regular basis, and we embed pharmacists within the physician's practice to work collaboratively with that practice to increase the level of patient care, to do the things that your general family practitioner, GP, might not have the full bandwidth to deal with. There's
Mm-hmm.
extra follow-up. There's
Mm-hmm. Mm-hmm.
wellness programs that need to be done that
Right.
most of these poor doctors are only able to deal with who's sick and coming in, much less clinically tracked diabetes,
Right.
COPD, and everything else that they have to worry about. And that's where we started to collaborate a few years ago, and are really pushing this to say, when we were in school, as PharmDs, we rounded on the floors. We were embedded with medical staff. These are things that we know how to do, and we're graduating 100,000 PharmDs a year. Let's get on. Let's get in there. Let's do this.
Yeah, yeah. No, I'm with you on that. I'm with you on that. And I think that most healthcare providers would agree with that concept. And I mean, look, I hope that this is not going to have to be the case. No, I would hope and would imagine that we would all be up to not only helping but working together. So I'm with you, and I think that's really good forward thinking, right? You talk about the Javits Center and all the different places that are opening up potentially to house patients if we come to that point. One of the problems with the coronavirus pandemic, in my opinion, has been that we've been acting a little bit too late, right? We have been sort of trying to play catch up all along, for a multitude of reasons and a multitude of things, right? But we are where we are. We're playing catch up. So what a great way to think forward and to sort of think ahead. We've got these centers opening up. We're trying to get ventilators. We're trying to get beds. But I hope that as a society, we're also collectively thinking about, okay, well, who's going to run this? Who's going to be there? And are we mobilizing all the sources that we can?
Dr. Jen, I watch the news, and I'm trying to balance what I watch, and most of the time
Yeah.
Twitter, because there's a lot of people that I follow that I trust, majority of them pharmacists, but many physicians that are in the trenches. The thing that worries me as someone who is an advocate of collaboration and information, good information, is the healthcare provider themselves. What have you seen in the field in working? How safe are our healthcare providers in order to care for all of these oncomings, which I think we're going to see obviously a continue. I don't think we're at the tip of the of this whole COVID-19 sickness and virus. So, what are you seeing with the health of our healthcare providers?
Well, I think it varies depending on where the healthcare provider is. We know that there are some places in the country that are not, well, fortunately, are not hot spots right now. They have very few to sometimes perhaps even no noted coronavirus cases. Practicing in those regions is going to be very different than practicing in Seattle and New York City. And now we're hearing Louisiana's coming up. Chicago, we have questions about, got seen on right now, and they're talking about Wisconsin and other places. So it certainly depends on where you are. But the other thing is, it also depends on what your facility has, right? In terms of the safety, I'm sure you all have, you're talking to your colleagues. I'm talking to my colleagues as well that are on the front lines through Facebook groups and other things. And there are many physicians who are in high sort of trafficked, or rather very busy areas with coronavirus that don't have the personal protective equipment that they need. They are worried going to work. There are some two physician households, for example, where, I've seen people writing on Facebook, hey, my husband and I now are no longer sleeping in the same bed in the same room. He's in the basement. I'm upstairs. We're trying to, separate as much as possible. We've got two kids. What are we going to do if we or one of us
Right.
gets sick?
Right.
People worried about personal protective equipment. They're worried about this sort of the safety of the environment that they're in. So I think it definitely varies, but I think that it's very clear that there are a number of places that don't have what they need. At least physicians saying they don't have what they need to feel as safe as they would like to feel, and as safe as we would like them to feel. And then that's a tragedy, because as healthcare providers, we can't get sick. And you all know this too, as pharmacists, we can't get sick. If we get sick, how are we going to take care of those other people who are sick? So I do worry about this. I really do.
I'll tell you more information that I was receiving calls from the large state hospital on Long Island, and the nurse who called said, "What am I supposed to do about getting hydroxychloroquine or treating my doctors who are on the front lines? And if I've got an ICU doc and we're calling and we have doctors in reserve coming in." So first I said, wait, why are we talking about this? I said, I'm the community pharmacist, right? Why are we having this discussion? Don't you guys already have a contingency plan in effect for your hospital to say, here are the guys who are the most closely exposed, and here's the next team that has to come in if somebody goes down, and here's how? She's like, oh, we didn't think about that. Wow. That's the first conversation you have to have with leadership of the hospital. That's something that they have to develop. And then you can worry about, are you going to prophylactically treat them? What are you going to use as part of your protocol for using hydroxychloroquine, if you're even going to use it? What patients are you going to use it in? What physicians are you going to use it in? That's something that has to come from Dr. Fauci and has to come from your leadership. And it's time that leaders step up and lead. Like, the restrictor plates are off. Some of the rules have been released. Practice medicine, practice taking care of people. Let the legalities per se of charting and we're not sure about this, we're not sure about that. Do what's right. If you practice the way you were trained, and you practice to do no harm, and you practice to do what is right, no one's going to come and say anything to you about it. That's my position.
Well, you bring up a lot of really excellent points, and one of them that I like is the importance of leadership. I definitely think now, during this time of coronavirus, we're definitely seeing kind of leadership sort of sift out, if you will, right?
Yes.
Not only on a national level, and actually that wasn't even what I'm referring to, but we can think of it leadership from a national level, but on even a state level. Yeah, state level, right? Yep. On a city level, and and even going down to our hospitals, and sort of how hospital leadership and hospital management is sort of handling this. This is a really really key time for the leaders in our country of all levels, because we're really looking to them for guidance. We're looking to them for protocol. What do we do now? What are the policies in place? And if someone gets sick, what is the schedule? How do we deal with this? So I guess that's just a note out for all of our leaders who are running departments and things like that. I think about my department chair. I'm a faculty member in a department. I'm in no way, a department chair or assistant chair or anything like that. Thank goodness. It's not my strong suit. But I feel really lucky to have good leaders that have really been proactive in giving our department guidance about how we should be proceeding. But in the lack of leadership, it makes it all that much worse. So
and there's definitely a difference between an administrator and a leader.
Oh, absolutely, absolutely. You're so right about that. And I think we're seeing also in this time, who are good leaders and who are not. And again, this is not a political statement. It really is just a factual statement on all levels. We're seeing Governor Cuomo in New York doing daily press conferences. My personal opinion is I feel really, I love seeing that, right? That gives me peace of mind, even though I don't live in New York. The fact that others aren't doing press conferences is neither here nor there, right? But we're starting to see how people lead, and that does make a difference for those, that they're leading. It really does.
So a question about the opposite, let's not even the opposite side, but let's look at the other areas that are involved, right? It's not just the community acquiring COVID-19. It's not just retirement centers acquiring COVID-19. Prisons and other facilities like that, maximum security prisons and just jail has this infection in their system. What do we do in that environment? And what is the risk reward of offenders being released early or bail reform situations where these people are getting put out back into the community but are awaiting trial, or low offenders? Or how does the safety of the people in the community, now being faced by two pressures on either side, disease and crime, play into any of our thoughts?
I mean, that's an excellent question, and one which I have to sort of admit that, the elements that it takes to answer that question are some that are not my area of expertise. You're asking a great question. We do know that coronavirus we're starting to see that in prisons, and what does that mean for prisoners, right? We know that if you are in a cell that's, only so big, the risk for infecting others and things like that, that is a very, very real concern. And then you also bring up, well, should we be releasing prisoners, and what kinds of effects would that have? That's a question that really involves so many different levels, not only law enforcement and sort of legal expertise, but also sort of healthcare officials in terms of talking about what our larger plan is regarding that. What I can say as a physician is our prisoners and those in the, in jails and prisons throughout the country deserve the same level of care than anyone else. That's one thing I can say, and that they deserve the same amount of attention and thoughtfulness as we are giving everyone who is not in jail. Everyone is still a person as far as I'm concerned. So, is it something that we have to be looking at and trying to figure out? Absolutely. Do I have the answers? No, I don't.
No, this is going to be something I think is taught in medical ethics classes for the next 1,000 years. I mean, this is really something that we haven't had to really face before. We did look at it in the Spanish flu epidemic.
I have a question, Dr. Jen. The FDA approves an emergency use of malaria pill for COVID-19 treatment. There seems like we have a rush factor here. Obviously, the public expects our leadership and our medical professionals and our researchers and even pharma manufacturers to step up their game and get us some type of notable, understandable, researched vaccine per se. But I am also seeing, the information from factual, evidence-based, peer-reviewed studies to getting it to market. It seems like it's really kind of started to increase in speed. What have you heard about this malaria pill?
Yeah, absolutely. This is, we're talking about hydroxychloroquine and also chloroquine. Those are medications used for malaria, but, hydroxychloroquine is also called Plaquenil, as you all know. Used for patients with inflammatory disorders, lupus, etc. So, these are medications that have been around for a long time, and that's a really great thing that at least the safety profile is something we've been dealing with for a while. I've done a number of segments about hydroxychloroquine and chloroquine, and I have to be honest, I think some of what we're seeing now is probably influenced by the presidents came out and talked very, very favorably and very highly about these medications. And rightfully so. I think that I am optimistic, and so many other people are optimistic. My understanding is that they are available for use through like an emergency sort of use designation at this point. The thing about these medications is we just don't actually know if they will work. That's the bottom line. We certainly hope they will. And there have been a couple of small studies. They've been observational studies. They've not necessarily been randomized controlled trials. They've been small observational studies that have, either seen some effect of these medication in vitro, so sort of in the lab, or on duration of illness in people. But, those are studies that really need to be repeated. They need to be duplicated. They need to be validated. There need to be randomized control trials. Now, I've done some videos on this on my Facebook page. I do daily coronavirus update videos. And when I did a video on this, people weren't really kind of happy with me saying we need more information. They were like, hey, why aren't you optimistic? We need everything and anything we can get. And I respect that and do understand that, and that's why we have these medications available for emergency use in some situations. So I think that's being sort of met, but I also think we just have to remind ourselves that right now, we just don't know if they're going to work. We hope, and I hope tremendously that they will, but we have yet to see, and hopefully we'll get some good news.
That's a great way to put it. I've seen the first small study that came out was mixed results with hydroxychloroquine. I was listening to SiriusXM's Dr. Radio, and they were doing grand rounds from NYU Langone. They do them now. They do grand rounds on. They record them for everybody to listen to, and they were discussing actually an interesting point where they're looking at people who have had a very strong immune response to COVID-19, and they seem to be doing worse off. And they're the ones that tend to wind up with the cytokine storm and multi-organ failure, sepsis, and wind up on ventilators. And they're finding that the longer they're on the ventilator, the less likely they are to come off a ventilator. And those who are not having a huge immune response, maybe recovering a little bit faster. And they were discussing use of immunosuppressors, not they weren't clear on what they wanted to use. It wasn't, I believe it wasn't Enbrel, and they weren't sure about HUMIRA yet, but they were thinking that somewhere within their system, they were going to do a study as they were doing it to look at the use of stronger immunosuppressors that would knock back that strong cytokine response.
Interesting. So I haven't heard much about that, the use of sort of immunosuppressants and in relation to the cytokine response. But, one thing we do know is that there are a lot of medications on the horizon and sort of therapies that we are looking at. Remdesivir is one that's being looked at. Obviously, we're looking at things like convalescent plasma. So, I mean, the good thing and the overarching sort of point and goal here is that we are looking at a number of different therapies to try to attack this. It's almost like we are studying in real time, right? Because we're living through this pandemic at the same time that we are studying it and studying the virus. This is not a drill, so to speak. We're in it right now, and I think it's wonderful that we also have no choice, but it's wonderful that we're really looking to see what can we use, what may work, and researching as we go.
Yeah, it's an exciting time in terms of being able to try to help. And people have to understand that just because we think there's something that can be used, it doesn't mean it's always going to work 100% of the time. We have to be free to try things. Right. We have to be free to use the scientific method. We have to be free to be critical thinkers, and do what is right and try through, models that we know certain drugs work a certain way. It would be right to apply it in this area, though we're not sure if it's going to be 100% effective. But we should be free to try those.
I agree. I think that, I do believe in the freedom and the right to try, but I also think that, we also don't want to do more harm than what's good. And that's the thing, there's a number of my followers who have said, well, what's the harm in trying? Well, the truth is we know there sometimes actually can be harm in trying. And that's what we're trying to temper with the caution. It's not to be a Debbie Downer. It's not to be a pessimist. It's to say that just because we can try it doesn't actually mean we should. And how do we determine what we try and what we don't? And we certainly want to, as physicians, we take the oath, do no harm, first do no harm. What we don't want to do is, at the risk of saying, well, let's try it, is to do harm. So that's the balance, and that's a very delicate balance. And I think, I think it's exciting that a lot of our community members are up on these medications because they're talked about in the news, and that's the right thing, right? People need to know what's being studied and what's being looked at. But once that happens, sometimes it's hard to sort of temper, and manage expectations and be cautiously optimistic, which I think as a physician, I am. I am optimistic, but do I want to do any harm? No, and that does have to be tempered.
Have you done or been able to see any information on the use of KEVIRA, which is an IL-6R inhibitor?
No, I haven't. What's going on with that?
Apparently, Regeneron and Sanofi are working to try to use it with hospitalized severe cases of COVID-19 to see if it doesn't reduce the cytokine storm.
Okay.
So that was one of the concepts that is possibly out there to protect a patient from themselves.
Right. Yeah, the body's.
Now, do you have any advice? Pardon me. Sorry. Pardon me. I got a cough here.
Sure.
Do you have any advice for patients who are already on Humira and Enbrel and other anti-rheumatic and also psoriasis medications in this time? Do you suggest they stay on them? Do you intermittently use it? Do you have any recommendations for patients who are in this position?
I don't, rheumatology is not my specialty. In all fairness, as a family doctor, no, I think the most important thing is for people to follow their doctor's advice and to check in with their doctor, just to make sure that their plan is what still should be right now.
Right, exactly. So any patients who are, that this reaches, we hope that you would reach out to your rheumatologist to discuss whether you should be continuing therapy.
Right. And don't necessarily assume that you shouldn't be.
Exactly.
I think, the check-in really should be just making sure that, you're good to go and you're getting your refills and things like that. And any questions that they have about this, remember, things that are on the horizon as possibilities, possibilities are not necessarily translated into clinical practice just because they're possibilities. So, yes, there are a lot of sort of concepts that are going on out there that we're thinking about, that we need to study and we need to trial. But that does not mean that that's the same thing as, clinical guidelines or clinical recommendations. And that's what I want people to understand is an idea is not necessarily a recommendation.
Correct. Thank you.
Dr. Jen, just shifting gears a little bit, about 60% of all pharmacists in the United States are women, and we're seeing leadership changes in our healthcare systems based on women taking leadership roles. What do you feel about the whole surge of women leadership? And you're one of them. I mean, you're so prominent now within. You've been on the Today Show and NBC Nightly News and Fox News and HLN and CNN, and so you're also blooming as this healthcare leader. But what do you see, and what do you feel about that, and why is it changing? Why is that accelerating so much?
And it's a great question. I don't know that I know why it's accelerating or changing. I think it's a good thing, and I hope it reflects really what women want to be doing. There are so many things in our history as a country, as a society, right, that have created that have caused what men and women have traditionally done for work over the years. And there are a lot of sociological and economic and even racial and cultural factors that have influenced that, right? I think that whatever the case, I think it's great that women are doing what they want to be doing. And I think it's also nice, 60% women. I think that's a pretty cool thing. Do I know exactly why? I don't, but as a woman, I have to say I like it. And I'm certainly not mad at that. But, I think what I hope is that women are finding their true passion, whatever it might be. And that they're following that. And so it'll be interesting to see in years to come, if the numbers still stay at like 60%, if they go up, if they go down, it'll be interesting to see where we are now in the full trajectory as time goes on. If there's something about, 2020 and this sort of time in space where women are pursuing medical fields. But, we know that our society works better when everyone is involved. At least that's certainly what I believe. Women, men, people of all races, cultures, creeds. I believe we work better when everyone has a seat at the table, so to speak. So I'm really glad to see, a lot of my fellow female cohorts in the game.
Absolutely. I have 4 daughters, and Jason has a daughter as well. So we're fans of
healthcare. Question for you, Dr. Jen. There's a lot of misinformation that's being put out there, not just by lay people, but by the mainstream media. Just some hyperbole, maybe saying that, everybody going back to work right now may cause 50% deaths, things like that we're hearing from different news organizations. What can we do as healthcare providers do to combat this perceived misinformation?
Yeah. I think one of the best things we can do is to talk about the truth as much as possible. That not only means, not only inside our own households and with our own family members through FaceTime and on the phone, but, through, things like your podcast, which is a pretty awesome tool to sort of get the word out to other pharmacists. Yes, we're sort of all part of the choir, right? We're preaching to the choir, but it still empowers all of us to be reminded to, hey, speak our truth when we are not amongst our colleagues, pharmacy colleagues, physician colleagues, et cetera. I think that's one of the best things we can do. Social media also is a very powerful tool as well, and we should use it. Everybody has their role with social media. Not everybody wants to talk, shop on social media. Everybody who's a healthcare provider doesn't necessarily want to do that, but this would be the time to do that, if any. That we're fighting, in some ways, I think with this virus, we're fighting the virus, but we're also on a much smaller level, but still present. We're fighting misinformation about the virus. And we have to all work together to really to fight that. Because one of the reasons why I do daily videos on my Facebook page is because really of all this misinformation, that's what really caught my eye. And I know the media doesn't always talk about the myths, although there are a number of fantastic articles out there, and I'm so glad they are. But the problem with us, consumers and patients and people in the community focusing on myths and putting credence in the myths is that it takes away from putting credence into solutions that actually work.
Yeah.
The more we start wondering if, drinking water every 15 minutes, which is a myth that's running around out there, cures coronavirus, or if sitting in a sauna will fix it, which is also a myth out there, or blowing hot air up your nose with a blow dryer, which that's also a myth out there. Oh yeah, there's millions of them, but the number of comments and questions I get about them is really what inspired me to do these videos, because I realized, even though I dismissed them and said, "Oh, that's ridiculous," what I realized is that there's a whole group of people that doesn't actually understand that it's ridiculous, and they were asking me, "Is this really real?" And the more that we focus and are trying to grapple with things like, "Are those things real?" the less we may be putting our faith and our attention into things like social distancing, hand washing, hand sanitizing, staying home when we're sick, paying attention to our symptoms. So it's a very real thing, and we can't dismiss the myths people have, because it's telling about maybe where they are, and that's an opportunity for information and education.
Well, I'm excited that you got a chance to come and share with our pharmacist community and the Pharmacy Podcast Nation and Network. We have 43 participating pharmacists now that are hosts on multiple channels, and we'd love to have you back when it's not so dire and it's not like sitting around waiting for
a pandemic.
No. Yes. But regardless, we were lucky to have you on, and I just want to, I'll be giving you shout outs now for the next month or two based on not only this interview, but the work that you're doing, because I'm a fan.
Oh, well, thank you so much. I really appreciate it. I really do. And thanks for having me. This is such an honor, and I'm really excited to talk to you both.
Dr. Jen, thank you for joining us today. It was really great to have you on, and I think that everybody is learning a lot from everything that you're doing.
Thank you.
You were listening to the Pharmacy Podcast Nation with Dr. Jason Cavallina and Dr. Jen Caudle. You can find her at drjencaudle.com. We will have multiple links in the show notes for her Instagram and her Twitter feed, and follow her. She's a breath of fresh air and soaking in the evidence-based information and not the Dr. Google that we despise sometimes when people are trying to self-information and data infuse themselves. So please, everyone, stay safe, social distancing, keep your hands washed, talk to your kids about COVID-19. Let them know. They are wondering what's going on. They've been out of school now for over 2 weeks, and they're probably worried too, just as the rest of us are. But we have to have our heads on and understand that we're going to get through this. And with that, I want to thank everyone for listening, and a special thank you to Dr. Jen. Thank you so much for being here.
Thank you.